We've talked about the Michigan Department of Education's Office of Great Start, but other state departments, nonprofits, and foundations are working hard on early childhood issues as well. Alethia Carr is the director of the Bureau of Family, Maternal, and Child Health for the Michigan Department of Community Health. Carol Walters is a founder of the nonprofit Women's Caring Program. And Karen Aldridge Eason is the foundation liaison to Governor Snyder. Ladies, thank you so much for joining me. I appreciate it.
Thank you for having me.
Alethia, let me start with you and talk a little bit about the role that health plays in childhood learning and development.
Well, health is key. First of all, infants have to live to be able to experience early childhood education. So we really focus heavily on reducing our infant mortality rate here in Michigan. That's one of the governor's priorities, along with obesity reduction. And we work to reduce the health disparity that exists between black and white infant mortality. In Michigan, for every 1,000 infants that are born, 7 die every year. We're really working to bring that number down. It's higher than the national average, and we're doing that by working to make sure that women are healthy before they're pregnant. It's key for them to have good nutrition, have chronic conditions under control before the pregnancy even occurs. And then during pregnancy, access prenatal care and access it as early as possible. With our infant services, we really look at making sure that women who are pregnant, especially low-income women, have access to Medicaid. That's an insurance benefit that allows women to, who wouldn't otherwise have access to medical care, acquire that care. It also is linked to having access to home visiting services that help pregnant women understand the resources that are available to them, as well as their infants, once infants are born, and helping them to learn about parenting and the important steps in parenting.
There are so many different facets to what the department is doing. So, Carol, why don't you explain for people who don't know, what is the Women's Caring Program all about?
Well, the Women's Caring Program is it's a nonprofit focused on the children from working families, low-income families. So we provide tuition scholarships for children ages birth to 5 for their early care and learning. But the parents have to be working and or going to school. So they're a family that's not eligible for any other state assistance, but still low income, still having a problem having access to early care and education for their children. And we're a statewide organization. We have helped families and clients in probably 81 of the 83 counties in Michigan. And we pay 40% of the tuition for a child to go to child care or early learning for a year.
That's got to be huge for a lot of families, a lot of parents who are struggling to pay those child care bills.
Right. We've been paying 40% for about 15 years now, and it seems to be a figure that really helps, that they can handle the rest of the tuition on their own. But the 40% figure seems to be a major help for a family. And now we've started to use the scholarships actually as an incentive in the centers, because the scholarships are guaranteed income to a provider for a year. And so we're using the scholarship as an incentive to enter into an agreement with the center to have improvements in quality made at that center where the scholarship is provided.
You know, Karen, there are so many different people who are involved in early childhood development and making sure that our kids succeed from birth to age 5 and beyond, and the foundations are a key part of that. How does that work with the programs that are already in place through the state?
Well, the foundations are often partners with state agencies or nonprofits. It's an excellent way for government, nonprofits, and foundations to leverage what are scarce resources sometimes. And so they have been actively seeking partnerships. They also often are able to push some of the issues like quality that Carol referred to, and making sure that in exchange for their partnership that the standards are raised, for example.
And how do you go about working through the governor's office with the foundations that way?
Well, I have a unique role that I work on both sides, both with state agencies and foundations. So when the government is looking at moving a program. Say, for example, recently Governor Snyder, had put in his budget $65 million and then another $65 million for early childhood. Some of the biggest advocates for that were foundations. And they can, while they don't lobby, they can definitely advocate and educate. So often they help educate as well, not only provide dollars, but they can help educate the public on how important it is for children to have this great start in life.
They need that great start in life, but Alethia, people might say, well, that's the parents' job. They need to get their kids ready for when they get them to kindergarten.
Well, actually, it's everybody's job. There's so much that has to be done to help make sure that children succeed early and throughout their childhood. One of the things that we do within our department is promote safe sleep, and that means safe sleeping environments for children. That carries over to child care as well as in the home. It really is a partnership. The whole immunizations that are available on a statewide basis is another way that health helps to protect children from conditions that could be harmful or even cause death. And
parents need those resources. Carol, as we wrap up with you, tell me, what are some of the reactions that you're hearing from parents who are being helped in this way with their kids?
Well, it's interesting that they're so excited about the learning that goes on in the centers where they can send their kids, and a consequence also, a positive consequence of the scholarships is the fact that the parents are actually doing better at work, getting promotions, raises, because they don't have, they're comfortable with the fact that their kids are at a center where they can be safe in a learning environment where they're cared for.
And it's so key. Thank you, ladies, so much for joining me.